Hi, I'm Justin Riley. Today on Wisconsin Doctors, right here on CW57, we will be on location at Upland Hills Health in Dodgeville, Wisconsin. And we will be shooting on location at the Therapy and Wellness Center here at Upland Hills Health. And I'll be joined by a variety of different experts who will talk to us about rehabilitation, orthopedic surgery, as well as sports medicine. And this panel includes...
I'm Dr. James Self. I'm an orthopedic surgeon, and I've been practicing here in Dodgeville since 2010.
I'm Melissa Messer. I'm an orthopedic physician assistant. I've been a PA for 8 years, and 4 of those have been here in Dodgeville.
And I'm Chris Thomas. I'm the director of the Therapy and Wellness Center here in Dodgeville, and I've been a physical therapist practicing for 11 years.
I'm Jerod Keene. I'm an athletic trainer, and I've been working here in Dodgeville for 2 years.
It's all coming up right here on Wisconsin Doctors. Whether or not you are going into surgery or coming out of surgery and need some rehabilitation services, or whether you just need to kind of loosen up a little bit, this is the show for you. Don't go away. It's all here on Wisconsin Doctors, coming up right here on CW57. Hi, welcome back to Wisconsin Doctors. We're here on location at Upland Hills Health in Dodgeville, Wisconsin. And we're going to start out by talking with Dr. James Self, who is an orthopedic surgeon here at the hospital. Welcome to the program, James.
Thank you.
So I want to start out by asking you a little bit about your background. How long have you been doing the orthopedic surgeon thing, and what type of training have you had?
Well, I'm originally from Dallas, Texas, so I did my undergraduate work. I have a Bachelor of Science degree in Mechanical Engineering from Texas Tech University and a Master of Science from the University of Texas. And then I did my medical training, medical school at the University of Texas Medical Branch in Galveston, Texas. I also did my orthopedic residency at that facility, and then I did a fellowship at the Mayo Clinic in Rochester, Minnesota. And my wife is from this area, so after training we decided to stay in this area. I've been practicing for a little over 20 years now. I have worked with a multi-specialty group, the Gunderson Clinic in La Crosse, for about 6 years, and then I was in an independent orthopedic group in Madison for about 10 years, and then in 2010 I moved out to practice in Dodgeville with the Dean Health System. Recently we have transformed our practice from Dean Health System to Upland Hills Health with the assistance of both Dean and Upland Hills, and so now we are able to see most of the insurance carriers in this area, and so we're able to provide services to many more people in the Dodgeville area.
That's very nice. Melissa, you had a question.
What was your practice like before coming to Upland Hills Health?
I've always practiced general orthopedics, so I've, as far as joint replacements, done shoulder and elbow, hip and knee replacements. We treat fractures of the upper and lower extremities from the shoulder to the fingers and from the hip to the toes. We treat soft tissue injuries, including ligament and tendon injuries of the upper and lower extremities. And we do arthroscopic procedures of the shoulder, the elbow, the knee, and the ankle.
Very cool.
Since you've been coming here out to Upland Hills Health, we've been fortunate enough down here to see a lot of your patients. And quite a few of them have painful hips. Can you tell us a little bit about total hip replacements?
Hip replacement's been around for a long time. It was one of the original joints that were replaced. There's been many, many changes over the years, many different types of hip replacements, different types of bearing materials. So I would say in the modern time, the present time now, that the most common, there's really two kind of categories of hip replacement, the cemented and uncemented. But no matter what type of hip replacement, nowadays most of the socket, the part that goes into the pelvis, is an uncemented component that's press fit and sometimes additionally fixed with some screws. The part that goes in the femur that replaces the ball, it's a stem with a new ball on it, is where the most variation occurs. And there are uncemented and cemented femoral stems. The cemented femoral stems have been around for quite some time. There have been many, many studies to try to determine if one's better than the other. Overall, they all do very well. There have been some small issues with both types. But more recently, we've been using more uncemented femoral stems. And so nowadays, for people under 70, the most common is probably to have an uncemented cup and an uncemented stem. Over 80 is probably an uncemented cup and a cemented stem. And in between, it's usually, a lot of times we decide at the time of surgery, depending on the bone quality. As we get older, everybody's bones get a little softer and a little, there's some deterioration in the bone. And so that has some effect on it.
Great question.
What are the advantages and disadvantages to the two different types of hip replacement?
Probably the main advantage with the cemented hip is that you can put all your weight on it right away. And for some people, that makes it a lot easier for the rehab. With the uncemented femoral stem, we tend to limit weight bearing at least for the first month. And so I think the major difference is how quickly they can move along in their rehab.
Well, Dr. James Self, I want to thank you so much for sharing that information with us. I'm just curious, can you tell us just real quickly, what would be, you do hip replacements, what's really quickly one other surgery that's very common for you to do?
Well, we also do knee replacements. Those are the two most commonly replaced joints. And then, as I said, many other things, fractures, soft tissue injuries, arthroscopies.
Very cool. Dr. James Self, thank you so much for joining us. When we come back to Wisconsin Doctors, we'll be talking with Melissa Messer, who is a physician assistant. Don't go away. It's Wisconsin Doctors right here on CW 57. Hi, welcome back to Wisconsin Doctors. We're on location at Upland Hills Health in Dodgeville, Wisconsin. And next we'll be talking to Melissa Messer, who is a physician assistant. Melissa, welcome to the program.
Thank you.
Now, we were talking before the interview that it's not physician's assistant with an apostrophe S, it's physician assistant. Is that correct?
That's correct. As a physician assistant, also known as a PA to many people, you a lot of times hear physician's assistant, but the actual term is physician assistant, no apostrophe S.
So tell us a little bit about what exactly a physician assistant does.
Sure. Well, we are licensed medical providers that we work under the supervision of a doctor. We can do many things that you'll see a physician do in office, including examinations, ordering labs and tests, physical exams. We assist in surgeries, and we also write prescriptions. Physicians have really opened up medical care out in the underserved and rural communities by providing access health care that not always can they recruit a physician.
Okay, very cool. Thank you. Chris, you had a question.
How long have you two been working together?
Sure. Dr. Self and I have actually been working together for about 4 years. We first started together at Dean Health System. We estimate that we've done almost 750 surgeries together, so I feel that we've really learned to work well together. Typically when a patient sees me in the clinic, they'll most often see me before and after surgery. So some people worry that they're not going to ever see Dr. Self again after that, but that's not really the case. He and I work closely enough together. I keep him informed of how patients are progressing and how their treatment has been going. And he's always there for me if I need to ask him a question and get further advice.
Cool.
So you and Dr. Self recently became Upland Hills Health providers. What does that mean to your patients?
Sure. It's actually been a wonderful thing for patients. It really opens a lot of doors. Prior, we could only take certain types of health insurance. Now, working with Upland Hills Health, that really expands that. There are several additional healthcare insurance providers that we can now see. So we're opening up access to orthopedic surgery and orthopedic medicine into a rural area. No one has to travel into Madison anymore or further. They can get their health care right here in Dodgeville.
So I'm just really curious, I just want to interject. Do physician assistants typically have a physician in particular that they work with, or do they bounce around? Because you mentioned you've been working with Dr. Self for a while. Do you work with other physicians here on staff?
Currently I do not. Dr. Self is my primary supervising physician, but PAs can work in many settings. Prior to Dean Health Plan, I worked at a different facility, actually with 4 different doctors. There were 1 other PA. So all different settings, you may work with several different doctors and you learn their routine and how they work. And doctors can also supervise up to 4 physician assistants at a time. So in the state of Wisconsin, a doctor is allowed to supervise 4 PAs.
Very cool. Dr. Self, you had a question?
Melissa, how did you choose this field and what do you like most about it?
Sure. One of the great things about being a PA is we can actually change what we do throughout our career. So when we're going to school, we don't have to pick a topic or a specialty right away. So because of that flexibility, it allowed me to start this job in orthopedics. Prior to this, I was actually in a different specialty. So when you came out to this rural area, this then allowed me to move closer to family and start over again. One of the great things about orthopedics I've found rewarding is that we help people with their pain. I think less pain definitely increases quality of life, and I think together we've really helped people feel better.
Melissa, I have a quick question. You probably see a variety of different patients, both who are either planning on getting surgery or good candidates for surgery, or people who have had surgery already. Are there folks that you see that maybe don't have surgery or are not candidates for surgery that you just see for other reasons and to just advise?
Definitely. One of the roles of a physician assistant is essentially to help that doctor see more patients, get the health care out there. So if there's a person who's not having surgery and maybe needs once a month visits to progress their health care plan, I see them allowing Dr. Self to have more time to see brand new people, which then doubles the amount of patients we can help.
Melissa Messer, thank you so much for joining us, and thank you for the great information. We appreciate it. When we come back to Wisconsin Doctors, we'll be talking with Chris Thomas, who is the director of the Therapy and Wellness Center here at Upland Hills Health in Dodgeville, Wisconsin. Don't go away. There's more Wisconsin Doctors coming up right after this on CW 57. Welcome back to Wisconsin Doctors. We're on location at Upland Hills Health in Dodgeville, Wisconsin. And next we'll be talking to Chris Thomas, who is the Therapy and Wellness Center Director for Upland Hills Health. Chris, welcome to the program.
Thank you.
Thanks for having us here. So we're actually sitting here in the room that is the Therapy and Wellness Center. Tell me what goes on here.
This is the hospital's main area to complete all the PT, physical therapy, occupational therapy, speech. We also have a chiropractor, acupuncture, massage therapy. We've got nutrition services. So this is the main area of the hospital that all that really occurs at. Most of it's all patient related, but we also have the facility that's open and accessible to all the employees of the hospital. They all have free memberships to come down here and work out to help promote that employee wellness that's becoming much more important out in the community now. And we also opened up all of the access to the community too. So any community member in the area that is looking for a place to come and work out can also join as a member and work out in this facility. The nice thing about this facility is how it's geared. It's really geared toward a certain clientele. We don't want to necessarily attract business away from other local businesses that are also trying to get people healthy. We are trying to attract a group of individuals that might have more fear, more apprehension when going to more of a stock facility. There is quite a bit of apprehension that comes with people that might be trying to recover from a surgery or just working out for the very first time, that they want to feel a little bit safer, a little more, what's the best word to say, would be just monitored. And we do a really good job of just making sure as people come in that we're monitoring what they're doing and they're doing it safely and they can come in confidently and get their needs met.
And that word safety was something that kind of stuck out in my mind. I was kind of thinking that before you even said it, that it's a safe place for people to work out. And you probably get a lot of traffic in here because you open it up to so many people.
Right.
Yeah.
We tried to gear everything up toward people that might be coming in a wheelchair or with a walker or with a cane, where we try and open the spaces up, we try and make everything accessible so that there's not that worry of bumping into things or bumping into more people.
Sure.
And then if something does come up where they're not feeling quite right, there's always somebody around, hospital personnel, that they can go ahead and ask questions of.
Thank you. Dr. Self, you had a question.
Yes, Chris. Earlier we were talking about different types of hip replacements, cemented and uncemented. From your point of view, how do you feel that affects patients' recovery and rehab?
From the beginning to end, I haven't really been able to see too much of a difference between how they end up in their function at the end and their pain and what they're capable of doing. They all receive the same guidance. They all receive the same precautions as far as don't lift your knee past 90 degrees, don't cross your legs, don't let your leg cross midline, because we want to protect those surfaces until they have a better time to heal. The absolute healing takes the same amount of time. The one big difference is how to protect that joint so that there's a good marriage on the metal and the bone on the uncemented side. So in order to do that, we follow your precautions of keeping people within their restrictions, so we restrict how much weight they place on it. And that is to protect doctor self-surgery, so no one has to go in and redo anything. So the biggest difference is limiting some of those initial exercises to more of a passive range of motion or more of an active range of motion without that weight bearing through it. But at the end, they all turn out really, really well.
Thank you. Melissa, you had a question as well.
How many therapists do you have here, and why would a patient want to pick this place for rehabilitation after surgery?
It's surprising. I don't think people realize that we have in the Therapy and Wellness Center 43 employees. It's spread out across physical therapy, occupational therapy, and speech, but the physical therapy side, we have 15 physical therapists that are in the facility and also help contract outside the area as well. We've got 6 occupational therapists also spread out throughout the facility and the environment, plus speech therapy and some complementary med folks. So
very nice.
There's quite a few.
Jerod, you had a question as well.
So Chris, after people complete their physical therapy sessions here, can they still continue to use this facility?
Absolutely. We want them to. We encourage them to because a lot of insurances only allow a certain number of visits, and there's still healing and strengthening that needs to take place. So we open up the facility for basically a post-rehab physical therapy access 1 to 2 months out in advance, and then if they are still liking what we're doing and want to continue, they can join as a member at a very good rate. So.
Chris Thomas, thank you so much for the information. Thanks for joining us. When we come back to Wisconsin Doctors, we'll be talking with Jerod Keene, who is the athletic trainer here at Upland Hills Health. Don't go away. There's more Wisconsin Doctors coming up right after this. Welcome back to Wisconsin Doctors. We're on location at Upland Hills Health here in Dodgeville, Wisconsin. And next we'll be talking with Jerod Keene, who is one of 3 athletic trainers here at Upland Hills Health. Jerod, welcome.
Thank you.
So we were talking a little bit before the interview that you like to make sure that people know that you are an athletic trainer, that's very important, that you're not just a trainer, you're the athletic trainer.
Yeah, Justin, it's something that as a profession we've just kind of really pushed for, so that just because there is a large amount of trainers out there, I mean there's boxing trainers and horse trainers and so forth. And
dog trainers.
Yeah,
so we were talking a little bit about that.
Yeah, so it's something that in a way, we've tried to push for recognition as a profession because we're a little bit of a newer health profession, and so that's one of the things that we've really pushed for.
Absolutely. So tell us a little bit about what an athletic trainer actually does.
Okay. Athletic trainers, we kind of collaborate with, well, physicians primarily, but also other members of the healthcare community, and basically we provide service for athletes or people that sustain orthopedic injuries. In a traditional sense, we usually would work with high school, collegiate, or professional athletes and taking care of their, basically from the second they get injured to the second that they return back to play. So that includes preventative care, that includes emergency care, or any injury that happens on the field. After that, we provide evaluations and diagnosis for those athletes, and then the end treatment and rehabilitation to ultimately put them back on the field.
Getting them back to doing what they do best.
Yeah. Exactly.
Very cool.
But those are more of our traditional roles. Now we've been working in the clinic, and also we at Upland Hills Health here, Brad, one of my coworkers, he actually helps at Land's End providing service for the workers there for the injuries that they sustain on the job.
So it's on-site help then. Mm-hmm. That's very neat. Cool. Dr. Self, you had a question as well.
Jerod, you recently started functioning as a physician extender. How has that changed your day-to-day activities?
It's changed it a lot. This is a new place for me that I haven't worked in the past. It's somewhat new to most athletic trainers, but using a physician extender in the clinic is something that's been happening throughout the country, and the idea is that the athletic trainer works aside a physician. In our case at Upland Hills Health, we work aside Dr. Self as a physician extender for an orthopedic surgeon, and what we do is help kind of guide the patient through the visit. We'll help with sort of the initial evaluation and the assessment, and then also after Dr. Self has seen the patient, we can help with providing patient education or crutch fitting or brace fitting or something that it kind of helps make the visit a little bit more efficient. And then ultimately the goal of having us in the clinic is to improve productivity and also patient outcomes and patient satisfaction.
And it's all about working together too, so
yeah,
that's great.
Yeah.
Melissa, you had a question.
Sure. With Dr. Self and I joining Upland Hills Health, that must have opened up these new opportunities. Has that affected you being an athletic trainer at all?
Absolutely. I would say that first off, we've really learned a lot working with both of you. We traditionally have worked with high school athletes, and so they're very healthy and only have, often acute injuries. Now we've had the opportunity to work with patients that you see that span from being, young children, even pediatrics, all the way up to older patients that need, that have issues such as arthritis, something that we never see when we're in the high school. So the learning experience has been great, and we look forward to working with you more in the future.
Awesome. Go ahead, Chris.
And Upland Hills Health has contracts with 5 area school districts, and we've got athletic trainers in all of them. And what are the types of things that you are seeing in those schools that you end up treating most frequently?
Most frequently, I would say that the acute injuries, and it really varies based on the sport. So in basketball, we see a lot of ankle injuries and knee injuries, where in football, we might more commonly see head injuries. And then once baseball comes along, it's the shoulder and the elbow that really take more of a beating with those sports. So the variety is something that makes my job more enjoyable, just because we're able to, it's not the same thing over and over again. It's often, every day is something different.
Are you getting a lot of concussion discussion still happening? I know that was a hot topic a little while ago.
I would say so, yeah. I would say from when I started as an athletic trainer about 4 years ago to now, there's certainly a lot more understanding for parents and coaches and school administrators. I mean, they're very concerned, and really they give us a lot of respect and really want us to, you know, make the best decision we can to help out their kids.
Jerod Keene, thank you so much for the information. And that's all we have for Wisconsin Doctors today. We've been on location at Upland Hills Health in Dodgeville, Wisconsin. We'll see you next time.